Newsday continues here on One News Now. I'm Riza Diaz. The OCTA research group has expressed concern about increasing cases in some areas in Luzon, including Isabela. Let's get more details on this. We have with us this evening Isabela Governor Rodito Albano is joining us via Zoom. Governor Albano, good evening. We'll circle back into Governor Albano on the latest situation again on Isabela. Meanwhile, COVID-19 deaths in the country are still a raging concern. In Tabuk City, Kalinga, records show increasing deaths as the virus takes its toll on the city. Speaking to us earlier, Tabuk City Public Information Officer Aurora Amilig said the deaths prompted the LGU to dig additional graves. The surge has also overwhelmed their healthcare system. We have also received a report that Tabuk is now experiencing a shortage in coffins.
We have recorded 46 deaths since Friday, but I think we have additional 3 this weekend. And like you said earlier, the city local government has ordered, the digging of additional graves in another barangay, which is because the burial site in Balong for COVID cases, according to the barangay officials, it's nearly full.
Amilig added that the city also suffers from a shortage of oxygen supply as suppliers have doubled their prices.
Hospitals are running out of oxygen, or they have actually run out of oxygen. And he wanted to purchase, these oxygen concentrators. We were discussing about the oxygen concentrators, portable ones that can be used even in our treatment facility, since the hospitals are no longer accepting symptomatic severe cases.
The global purge of working women in the pandemic is leaving an economic toll in its wake. It was estimated that women lost at least $800 billion in income last year. Let's watch this.
And it's time now for a quick take by the numbers, where we give you the data that tells the story. This morning's number is 3.5 million. That's how many mothers of school-aged children in the U.S. left their jobs when the pandemic struck. From school shutdowns, daycare center closures, and the ensuing juggle between employment and caregiving, working women primarily bore the brunt. It caused a work exodus that U.S. Vice President Kamala Harris deemed a national emergency, with experts saying prosperous nations need working women. And it's a problem being felt all over the world. By the end of April last year, less than half of the women in Brazil were employed, the lowest level in 30 years. In Australia, around the same time, nearly a tenth of women exited the workforce, while in Japan, women lost jobs at nearly twice the rate of men. So joining us now live to discuss in Washington is Bloomberg's economics reporter, Olivia Rockman, who wrote about this for Bloomberg today. Olivia, thank you so much for being with us today. These numbers are really just crushing. I mean, can you put into context what the implications of this are for the global economy, considering this is happening all over the world?
The childcare crisis has resulted in many women having to leave their jobs either permanently or at least temporarily during the pandemic. And one estimate shows that there was about $800 billion in lost income worldwide from women because of this. And so the implications of improving the childcare system are really large for labor markets and economies worldwide.
Talk about that, Olivia. I mean, what is it that labor markets and economies are doing to address this at this point, to prevent what your article says could be an economic fiasco?
It's interesting. We've done a whole lot of reporting in the U.S. about the American Families Plan and some of President Biden's efforts to increase childcare availability and affordability. But what we learned in this reporting is that this really is happening across the world. In Canada, for example, there's an effort to pay for half of a family's childcare costs. In Australia, there's been money added to the budget there to also support childcare, and we've seen it in local cities in Brazil as well as Japan. So it really is a global issue.
Well, and so what's working in some of these countries? Because a lot of these support systems that have been set up, you note, are temporary. So what is working in your reporting? What did you find?
It's the countries that are trying to extend some of the temporary policies that they put into place early in the pandemic to be longer term. So in Australia, for example, the country made childcare free for 3 months right when the pandemic started, and that prevented women from having the same number of job losses that we saw in other countries. And now the government is trying to subsidize childcare, not making it free, but making it more affordable. And the effort is in the hopes that that will prevent longer term, women leaving the labor market. But in other countries like Brazil, where they have a conservative government, it's unlikely that the national government will support this. And so there are cities like Sao Paulo that are trying to do it on their own.
Now, circling back to our top story, the OCTA research group has expressed concern about increasing cases in some areas in Luzon, including Isabela. So let's get more details on the province COVID-19 situation. Joining us this evening is Isabela Governor Rodito Albano. Governor Albano, good evening.
Yeah, good evening, Lisa. Good evening to all your viewers. Yeah.
Gov, can you give us the latest situation, the latest COVID situation in the province? Are we seeing more cases being reported over the past few weeks?
Yes. Actually, Ilagan City is is asking the IATF for a lockdown, starting tomorrow maybe. But I told them, if you do that, please let's notify the IATF before doing it, because the COVID cases there is surging already. And we're at a critical risk now, based on the reports that I've received. Our bed capacity is over 175% already. So meaning we have no more available COVID-19 beds.
Mm-hmm. Gov, with that being said, we'd also like to check on the welfare of your healthcare workers.
At least their confidence is high, and at least there's not much infection on our healthcare. On our healthcare personnel, and also all our healthcare personnel already have been fully vaccinated, Lisa.
Mm-hmm.
So I'm not worrying about them. I'm worrying about the surge of this virus, because nobody expects where it hits. Sometimes suddenly a municipality would report to the province that we have about 140 or 200 cases here already in a span of maybe 3 days. And as of now, we have 4,000 active cases here in the province of. We have 5,189 active cases here in the province. So, but I cannot tell you one by one, because there are 34 municipalities here.
Gov, are there new protocols being implemented in the province again to prevent the further surge in cases?
What do you mean protocol? We just follow the protocol of the IATF, and it's up to the mayors. If they want to impose some protocols that they wish to impose, I'm giving them I've given them autonomy on doing that.
Mm-hmm. We'd also like to check, Governor, on the vaccination program in Isabela. Is the province receiving enough vaccines for its residents?
Yes, I think they promise us. We have about 15% vaccinated for the total of for the entire population of Isabela. We have 15% total of vaccinated individuals. We're expecting 100,000. Secretary Galvez and Secretary Duque promised me this week they'll be giving me about 120,000 doses of vaccines, maybe Pfizer and Sinovac, and a little more. And on October 1, Secretary Bebot Bello got about 10,000 doses for construction workers. to be vaccinated here in the entire province. That's about 5,000 construction workers. So I think to be fairly okay, at least up to maybe March, we can fully vaccinate the entire population if this is the trend. You know? If they'll give us about 100,000 in a span of 10 days, maybe 100,000 doses every 10 days, then we can vaccinate about 90% of the population here in the province.
Governor Albano, in closing, what would your recommendations be as to the alert level system that the province of Isabela should implement?
We're on alert 5, I think, based on our MHO and PHO, the provincial health officers and municipal health officers. I think they raised our alert level to alert level 5. But as a politician, Risa, sometimes I don't understand what the alert levels are being imposed in the province.
All right. We'd like to thank you, Governor Albano, for sharing with us your time, those information and your insights. That is, again, Isabela Governor Rodito Albano.
Thank you very much, Lisa.
Thank you, sir. Meanwhile, the Health Department reports over 20,000 new COVID-19 cases. This has brought the country's total caseload to 2,490,000, some 161,400 of which are still considered active. The DOH also reported that 72 duplicates were removed from the total case count. No new COVID-related deaths were recorded today due to technical issues in COVID Kaya. The death toll remains at 37,400. Now, total recoveries have now reached 2,292,000, with over 24,000 new survivors logged in the past 24 hours. 21.9% of the 74,400 total tests conducted yielded positive results. The OCTA Research Group maintains that Metro Manila remains at high risk for COVID-19. Based on their latest report, the NCR averaged 4,220 cases in the past 7 days. The one-week growth rate is at negative 20%, while the reproduction number is at 0.94. OCTA also classified Navotas, Maloban, Manila, Valenzuela, and Pateros as moderate risk. The rest of NCR LGUs remain at high risk. Let's take a look now at the other day's top stories. Senator Richard Gordon barred that the Senate could no longer contact Pharmacy Officer Crizel Grace Mago amid their offer to give her protection. Mago previously said she tampered the expiration dates of face shields delivered to the DOH upon the order of Pharmacy Corporate Treasurer and Secretary Mohit Dargani. Mago also believed that the company may have been swindling the government. Typhoon Mindulle has intensified further while moving slowly over the Philippine Sea. The typhoon, with local name Lani, was located 1,590 kilometers east of northern Luzon. Pagasa said it may enter the Philippine area of responsibility on Tuesday or Wednesday. And Alagang Kapatid Foundation, under the MVP Group, together with other non-government organizations, delivered and distributed food packs, PPEs, and other essential items to areas in Batanes devastated by Typhoon Kiko. The relief packages arrived on Saturday through a transport vessel provided by the Philippine Navy. Now, for more updates, visit News 5, The Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now, www.signalplay.com, and stream One News live anytime, anywhere. I'm Riza Diaz. Mask on, wash hands, and stay safe, Philippines. We are One News.